Good morning. My name is Dr. Aime Irahosa. I'm a PGY2 resident here at the IU Arnett Family Medicine Clinic. Today I'm taking on a virtual tour of our clinic. This is our patient waiting area. This is where our patients check in, of course, 6 feet for social distancing to keep everybody safe. This is our waiting room. We have lots of lovely greenery here. Really brings light to the space. Down that hallway, we have bathrooms and, of course, a conference room. In here, we have a nice consultation room for some patients when we want to discuss with our dietitian or our behavioral health team, things of that nature. Let's get into the clinic. So welcome to the clinic. This is where we get, of course, our vital signs, our heights, weight, things of that nature. Let me take you down into this patient room. So this is our patient room. Very spacious, has all our supplies that we could ever need. Down this hallway, we have several bathrooms, more patient rooms. We also have offices for our NP and our pharmacy team down this way. So we have 4 identical hallways that have similar things on them. In the middle here, we have our fishbowl. So lots of action happens here. This is where our MAs sit. They work on their daily, taking patients, things of that nature. We also have additional workstations for us to sit if we want to. And in here, we have our residency workroom. Oh, hey, Dr. Mitrila, how are you doing?
Hey, good morning.
Good morning. Ready for clinic today?
Yep, just chart prepping. Inbox, getting ready. So.
Wonderful. So this is where the residents sit when we're working in clinic. We have, of course, supplies here. We have study materials here and like modules, things of that nature, just to prepare for our patients and, of course, our exams. Down this hallway, not hallway, but down this room, an identical style room, is our preceptor room. So this is where our preceptors sit. We have Dr. Williams in here and Dr. Dams. Good morning. How are you guys doing?
Good. How are you?
Doing wonderful. Thanks for asking. Ready for clinic this morning?
Absolutely.
Like always.
Yes.
We have other additional workstations here for other attendings when they're in clinic. Down this hallway, swing to the other one, we have our triage room. This is where our nurses sit. So they answer phones, talk to patients, and medicine refills. Good morning, how are you doing? And then of course we have this room here, our lovely patient room. It's decorated year round because it's so pretty, patients love it. But in reality, it's just another patient room, like our other ones, just with a little extra flair. In here, we have our lab. So we have an inbuilt lab in our clinic. This is where we do our A1Cs, we get all our blood draws, things of that nature. That all happens down here. And of course, more patient rooms on this way. So we have 2 other hallways that are very similar to this. Down this way, this hallway here leads to the back room, or back area. We have storage rooms here, additional supply rooms here, and 2 more patient rooms down this way. Back here, this is where we usually are when we're not directly seeing patients. So we have offices down here for our attendings. We have our virtual patient room here. This is where we see most of our telehealth patients, but we can see them anywhere else too. Back here, nice IU background for our patients. And this is our den. Hey, Dr. Daisy, how are you doing?
Good, how are you?
Thanks, I'm good, thanks for asking. So this is our den. We have our lovely den cat, Coco. She's our den mascot, lovely couches here. This is where the residents pretty much hang out and do notes when we're not actually seeing patients. Another resident mascot, we have Skelly. And of course, we all have cubbies and we all share workstations. We have here our lovely ping pong table. So this is how we unwind here, among other things. This gets a lot of use when you're on inpatient and you have some downtime, or when you just want to hang out with some friends and you have downtime in clinic. Well, after clinic usually. In here we have our Unfocused Room. This is where we get, again, more work done, more virtual visits. It's more like a quiet area so you can kind of focus and work if you need some quietness. And here is our chief's room. She's actually not here right now. She's on inpatient, as you can see, but this is her office. So down this hallway, again, just more art from the wall. We do lots of paints and sips or paints and gatherings in our program. So this is some of our artwork that we've done. Awesome A1 artists that go here. Down this hallway, we have our bulletin board. Lots of announcements and things happen here. We recently had a fundraiser for YWCA. As you can see, all of our teams met our goal, so we raised lots of money for them, which is wonderful. More bathrooms down this way. Offices here. Here, this is actually our family tree. It's currently incomplete. We need the first year class pictures on here as well. But yeah, this is pretty much how we kind of all stay connected. We're in groups of 3 for family. This is our program coordinator's office, Molly. Hi, Molly.
Good morning.
How are you doing?
Good, good.
And in here is John, our clinic manager. Hi, John.
Good morning.
Good morning. And of course, here it's our kitchen. Food's always important, so we have fridge and everything of that nature here, and we sometimes have communal snacks and things of that nature in here as well. More offices here, more offices here as well. And of course, safety first. Gotta keep your hands clean. Alrighty, well that's our clinic. If you have any questions or concerns, please email our general website that should be available on our site. Thank you.